Access DuPage was organized in 2001 and represents a unique partnership of hospitals, physicians, local government, human services agencies, and community groups working together to address the national healthcare crisis. The mission of Access DuPage is to provide access to comprehensive medical services to low-income, medically uninsured residents of DuPage County. In 1989, the DuPage Community Clinic began as a one-room clinic in a house with one volunteer doctor. It has since then grown to serving over 4,000 individuals annually, with over 120 volunteer doctors and nurses. The mission of the DuPage Community Clinic is to provide quality primary medical care, specialty care, and mental health services to low-income, medically uninsured residents of DuPage County in an efficient and cost-effective manner. Having similar missions and a long-standing partnership, Access DuPage and the DuPage Community Clinic officially merged in July of 2012. In 2012, Access DuPage served over 14,000 patients and coordinated 4,000 specialty care visits.
I have worked in healthcare for a long time and have supported many charitable funds. This one is different.
I would recommend this to anybody that didn't have insurance and can't afford to go to a doctor. I mean, they live in DuPage County. This is the best clinic to help.
I look at it as a palace, really, kind of a palace, for all the tremendous amount of positive work that gets done there.
They were very, very nice. Everyone I have dealt with has been wonderful.
Lauren Baer and I are co-chairs for the the specialty referral program into DuPage Medical Group from DuPage Community Clinic.
Back in 2011, DuPage Medical Group realized there was a great need for specialty care visits at DuPage Community Clinic. So at that time, an initiative was born called 5 and 5. And that was basically 5 specialty clinics in 5 months. We just had to find a way to get patients that were on a wait list at DuPage Community Clinic seen in 5 months.
So we make individual phone calls to managers, directors, employees, physicians to help expedite that care for that area of specialty for that patient from DuPage Community Clinic.
We saw patients on site at DuPage Medical Group. We saw patients on site at DuPage Community Clinic. There's various ways where we got these wait lists that DuPage Community Clinic had down.
And we do see Access DuPage patients here, so I know the patients, I know the need, I know what's going on. And then I think in the fall, September, there was an announcement that a physician was leaving, that group practice, and they were a little short, and I thought that was a good opportunity for me. The timing was good for me to kind of move in and go there a couple afternoons a month.
The best, the most high-quality surgeons are participating in the care of these folks, and then you see outcomes where they don't have to take time off work, where it's very limited. They remain functional. They can keep their job, and so they can participate in their family.
When the charitable fund started, Perry Todd became the director, and I volunteered right away. That's how I got involved. Perry's a great person to work with. She's very charitable. She's very compassionate, and she really wants to help our community and support our organization.
But the practice is nice, the people there are great. The patients are much like the patients we see anywhere. They just don't have the insurance, so they need some help in that area.
These are people who are underemployed, unemployed. Most of them actually working full-time, but just not making enough to support their families and support a premium.
Our physicians love to see these patients. They love to volunteer. Everybody that has gone on site at DuPage Community Clinic has come back saying that it was a very positive and fulfilling, rewarding experience, and they want to go back.
Feel good all through the day, because at one time I wasn't feeling real well, I felt sick because I was sick, Now I wake up in a good mood, feeling better, feel great.
So through DuPage Medical and their expertise to Access DuPage, I can't even express how grateful I am.
I would encourage others to volunteer. I have encouraged others to volunteer.
Volunteering is not just for physicians, it's for anyone.
The need is real, the need is palpable, and it's desperate.
These patients are so grateful for the care that they received. They're so grateful for the time that you spend.
Anybody can get involved. Everybody needs help at some point in their life.
But I would say just remember it's there, and when you are, it's a great staff to work with when you get there. And it's really very gratifying, I would say, fun and rewarding. So when you're ready, it's a very positive thing to do.
We want to make the physician's job as easy as possible. So if they'd like to volunteer, we do all the work for them. We coordinate the visits, we coordinate patients coming to their office, we coordinate clinics being set up at DuPage Community Clinic. Whatever method they would like to see patients, we set it up for them.
The amount of good that you do is not always measurable, but it's palpable. That when you're keeping people functional and stable, that it's healthier for the community overall.
To see the joy and relief in patients' eyes and in their families' eyes, the belief that they are being taken care of is very rewarding for me.